Welcome back, everyone. In our previous session, we broke down the different types of diabetes mellitus, type 1, type 2, and gestational diabetes. Today, we shift our focus to a lesser known but equally important condition, the so-called diabetes insipidus. So our main focus is on diabetes insipidus, also known as the DI. Now, despite the similar name, this has nothing to do with blood sugar. Let's dive into diabetes mellitus. Diabetes mellitus, what is it by definition? And what is that different thing between diabetes mellitus and diabetes insipidus? So, diabetes insipidus is a rare condition that causes the body to lose too much water through urine, leading to extreme thirst and frequent urination. So, unlike diabetes mellitus, which is related to insulin and glucose, diabetes insipidus is about fluid balance and hormones. So, diabetes mellitus, insipidus is about fluid balance and hormonal balance. So, when you look at it, fluid balance, when you talk about fluid balance, is about the water. Hormonal balance is about the ADH and other hormones that are responsible for the regulation of the body fluids. So the keyword here is nothing other than the ADH, the antidiuretic hormone, so-called the vasopressin hormone. So the ADH is the hormone responsible, or the so-called vasopressin hormone is the hormone that is responsible for the regulation of the body fluid, which is water in the case of that. Now, it plays a critical condition, and with it, we can learn impact and how it happens. Now, the system for this diabetes insipidus to operate, we have so many things that are involved. We can talk about the organs that are involved and define it in a different angle that we need it to be known. So the first thing that you should know that the ADH, the antidiuretic or the vasopressin hormone, is produced in the brain at the pituitary gland. So we have the brain responsible for the production of the ADH in the pituitary gland. The ADH is the antidiuretic hormone. Now, this one, the ADH has been produced. So the ADH helps in controlling or monitoring the balance of water in the body. So what is the organ? Which organ is responsible for reabsorption of water molecules and mineral salts in the body? Is the kidney. So it gets us to the kidney. Now the kidney is responsible for reabsorption of water. Now kidney, we have reabsorption of water and mineral salts. But for this case, due to our own interest, we are going to talk about water. Now, what are some of the things when everything is working well? ADH tells the kidney to hold on to the water. But with diabetes insipidus, either the brain isn't making enough ADH, which is this one, the brain isn't making enough ADH, or the kidneys are not responding to it. Now, the kidney isn't responding to the brain, which is the ADH. So it brings about the condensation of different types. This causes too much water to be lost in urine, up to around 20 liters a day in severe cases. So for that reason, we now dive into something known as types of diabetes insipidus. So the types of diabetes insipidus, we are going to classify them into four, and you will realize that they are really related to the brain, the kidney, and the parts where the absorption and water issues are responsible, and the other one is through the birth or the pregnancy effect. Now, the number one type of diabetes insipidus, we call it the central diabetes insipidus. This is a result of when the brain is incapacitated to produce a number of ADH. So this is the most common, and it is caused by the damage to the pituitary gland or the hypothalamus. The damage of the pituitary gland can be as a result of some tumor growths, surgery, or as a result of head injury. Number two, we'll talk about nephrogenic diabetes insipidus. So nephrogenic diabetes insipidus is as a result of the inactivity of the kidney. Now, from the word nephron, it touches on kidney. Kidneys don't respond to the antidiuretic hormone produced by the pituitary gland in the brain. This causes the nephrogenic diabetes insipidus. So it can also be caused as a result of medications like use of lithium components. So lithium components are very dangerous to our kidneys, and they may hinder the proper functioning of the kidneys. The number three type of diabetes insipidus is the dipsogenic diabetes insipidus. So dipsogenic diabetes insipidus, we have it is coming from problems in the thirst mechanism. As a result of heavy thirst, which is a clear symptom for diabetes, the mechanism often causes a number of mental health, which is resulting to a brain damage. Number four, it is similar to the one within the diabetes mellitus, as we discussed, and it is called the gestational diabetes insipidus. So gestational diabetes insipidus happens during pregnancy when an enzyme destroys ADH. This one is a result of an enzyme destroying antidiuretic hormone or the vasopressin hormone. So this enzyme we always say that enzymes are catalysts of reactions, and we have catalysts of reactions when a mother is pregnant and is undergoing the process of gestation. We always experience a number of water loss and all those processes. So the body has to be able to control the water molecules within your body, and this can result to diabetic insipidus only if the enzymes destroys the ADH. And for that reason, let's dive further into what are some of the symptoms of diabetes insipidus. So when you look at the symptoms of diabetes insipidus, they are somehow common and related to diabetes mellitus. But in details, you can realize that they are not that common. So main symptoms of diabetes insipidus, we have excessive thirst, also known as polydyspia. So polydyspia is a situation now you produce or you feel like thirsty every time. It's called polydyspia. Number two is polyuria. Polyuria is a situation now, the frequency of urination. So as a result of polyuria, that can be a symptom for diabetes mellitus, diabetes insipidus. Then we have dehydration, we have fatigue, the tiredness, the exhaustion. Then we have the electrolyte imbalance. When we talk about the electrolyte imbalance, we have a number of electrolytes in our body. We have the sodium ion, we have the chloride ions, and also we have the potassium ion. When these electrolytes, the electrolytes are not balanced, they can cause what is called diabetes insipidus. At the beginning, we say that diabetes insipidus is as a result of two things: the hormonal imbalance and the fluid imbalance. So both of them are categorically controlled by the electrolytes within our body. So diagnosis is always done for this, and we can do it in a number of ways, where we have the blood test, the urinalysis where you analyze the urine, and also you can do what is called the MRI scan. The MRI scan enables you to observe the pituitary gland damage, or any of the structures of the brain is damaged in a way. So treatment depends on the type. So with a number of ways and treatment, you have to consider it from your doctor and medical professional, who will always advise you on the best medication for diabetes insipidus. Um, so while diabetes insipidus shares a name with diabetes mellitus, the causes, symptoms, and treatment are very different. Thanks for watching this whiteboard lesson. If you found it useful, give it a like, share, and subscribe to more simplified biomedical topics. And until next time, stay informed and stay healthy. This is Benjamin Kola, breaking down health the smart way. Till next time.